Hey everyone, what's going on? This is Max from Unsubscribed Healthcare, and we are going over the Clearinghouse tab today. This is on page 36 of your user guide. The Clearinghouse tab is used for interacting with external clearinghouses such as Office Ally. Office Ally is the only one who has given us the information that we needed in order to create CSV files that can be uploaded to them for the purpose of insurance billing. Clearinghouse tab is also used for CMS 1500 form creation with or without the grid. It also is used for making patient profiles so that you're able to recall this information easier, as well as saving information to the billing tab. When you first get it, there's an issue with the screen resolution and how it changes from person to person, so the buttons are typically out of order, and what you need to do is you need to rearrange them. To do this, you right-click, and once you see those dots appear around the button, you will bring it up. So again, right-click on that button, and then drag it into place. The options for CSV are Save, Add to, and Clear. The options for CMS 1500 form are Save with no grid and Save with grid. And the options for billing are Add to, and the options for patient information are Search, Save, and Clear. Going on from here, this is how you will use this. You want to select your patient, and you want to fill in the information below. Starting off at the row 7, we're going to get rid of all of these red boxes by filling in the information. So all of this is very similar to the CMS 1500 form, so you would fill it in as if you were filling in the CMS 1500 form. Fill in the group health plan or Medicare based off of what the patient's insurance is, and then coming over to F7, do you accept assignment? If you click yes, that is for billing purposes to insurance. And if you click no, that is for saving with a no grid so that patients can get a super bill to then send that to their insurance. You can notice right away that the insurance doesn't quite format the way that we would want it with this hashtag NA. So in order to fix that, we need to put in an insurance company. If it's not an exact match, it won't pull forward. To add an insurance company, you want to go up to Unsub menu, go to ICD-10, physician and insurance company, and then click on insurance company info. You could also pull this form up by clicking on the insurance company info tab and then clicking that insurance company info button right there. So I'm going to paste in the insurance name there so that we have an exact match. Then you put in the payer ID, and then you're going to put in office number, street address, city, state, zip code, and basically we are building a profile for this insurance company. Click submit, and now you can see it instantly pulls in forward there. Checking on the first row, all this information that we need here is pulled forward from the patient intake form, so there's nothing that we need to fill in here. If we go into column D, again, all of this is black. Again, in column D, all of this is filled in, and so there is no red here, so that we can continue on. Diagnosis code we need to add. This is searchable, so if I want to put in low back pain with right knee pain, I'm able to select on those codes, and they will be there. Make sure that you use the same codes that you have on the eval. And then we continue on in column F. You can see it says, please fill in the dates of service from in cell B29. So we would do that here. We are going to put our eval, we'll put moderate complexity, and we're going to put in the date of service as today. Now you can see those two sections that used to be red are no longer red. And so we will come in here and see F15 needs to be filled in, and that says please select place of service in cell B27. So I'm a mobile therapist, so I like to see people at their houses, so I'm going to put 12 for patient residence. Continuing on with column F, charges below need to be filled in, so we will put those when we fill in the CPT code. Amount paid, if they had a copay, we would put that there. And selecting the provider, so we'll select John Smith as that. And then you can see here, we need to have Tom Riddle have a NPI number, and to get that, we will go back up to the unsub menu and add physician. So Tom Riddle has not been added yet, so we will add him as well. So we're going to put Dr. Tom Riddle, and then you put in their NPI, their phone, their fax, and their company. Click Submit. NPI number will appear. Continuing on, the CPT codes, you will fill in, add in the modifiers that you need, and then add in a diagnosis code pointer. You want to add in your charges, your units, ID qualifier. Now that we have our CPT code 1 filled out, we can actually make this fill in a lot faster. If we come over to the section E28 to G39, we can select what CPT codes we want to affect. And then we can come down here to add in the same dates. We can add in the same modifiers, diagnosis pointer, CPT codes. We can charge the same, as well as the same amount of units as the previous one, same ID qualifier, and same provider. I'm going to take the charge off because what I'm going to do is that when I select the therapeutic exercise, you can see that 75 comes up automatically. If I come down here and I click in manual therapy, you can see that manual therapy charge automatically comes up. Neuro will also come up automatically. The way that this works is that you come into billing, and in the charge section next to the CPT code, you will put the charges that you normally put in there. In that way, when you click the charge that you want, it will be placed into the charge section. From here, what we can do is that we can click Add to CSV File. If we do multiple days, so if we come over here and change to the next time the person comes in, and then we say that this is now electric stim, okay, you can see again, charges are now updated, dates are now updated, and I can click Add to CSV File, and then that way when we click on Save CSV File, you're going to see two different charges for two different days. This is hosted in that clearinghouse folder. But you can see here, these are the files that are been created for that patient. And if we keep scrolling over, you can see the dates of when we get to the CPT codes. So here you can see from date service is 11/19/24, and over here is 11/22/24. So you can see both have been updated and uploaded. The next time we want to create a CSV file, we want to click Clear. Then you click Save, and you'll see that there will be no patient billing codes listed. And then you are ready to have a fresh start for the next time that you would want to send out a CSV file to Office Ally. After you've created a CSV file, you will need to then go to Office Ally's website and upload it directly to them. This does not automatically upload to Office Ally. This just creates a file that Office Ally should be able to accept. The CMS 1500 form option, we can save with no grid. And this will save into the patient's folder. And we can review that. So if you have a pre-made CMS 1500 form, you can then print this to that, and you would be able to mail that in and send it into the insurance companies. If you want to save it with a grid, this is great for giving it to patients for reimbursement, so that way you don't have to continue to use your pre-made forms. And this is what that looks like. So you can see all of the information is filled in, and it is put into the correct spots. What we can do now is that we can click on the Add To for the billing tab, and you'll see a running script. And once it's done, it will say finished. Check on the billing tab this way. $11.19, and then there you go. And you can see all of the CPT codes and everything else that you did. The patient information options are search, save, and clear. When you click on save, it will save the information that we have put in below. So all of the information that we have had to fill in, it will fill in automatically the next time. So if we click on save, you'll see that I already have made a profile and it's going to give you a warning. If you've had to update any of the information for your patient, you would want to click yes to update the existing entry. If you haven't, you can click no, but we'll update. That way, when we click clear, we have the options to start working on a new patient and selecting a new patient, or we can go back to Max Shippen, click on his patient ID, and click search. Now you can see that the information has mostly been filled in. There are some areas of red. I have been able to bring forward the CPT codes that I used the last time, but it does not bring forward the dates of service. This is to prevent duplication of billing, and it forces you, the user, to put in the place of service as well as the treating therapist, and then also the dates of service as well. If you are able to communicate with another clearinghouse and you're able to find out the CSV format that they require in order to accept a CSV file, once you have obtained the CSV headers and information that you'll need to collect, you will want to replace the headers in row 73 with the new CSV file headers that are indicated by the new clearinghouse that you have been able to contact. After that, you will want to make your own information collection area. You have 8 columns to play with. So you have column J through Q is Office Ally. When I click on the clear button and I have Office Ally selected in cell C1 and I click clear, it will copy and paste columns J through Q into columns A through H. If I select Clearinghouse 2 and I click clear, it is going to copy columns R through Y and place them into A through H. You can see R through Y has no information. You will be able to make your own clearinghouse information collection area by putting in row 6, the name of the clearinghouse, and then format any of the information that you would need below that. You can use the Office Ally collection as an example when you make your own. After you have formatted your own collection, data collection area, make sure that it works by clearing it out and having your clearinghouse selected. It should populate underneath here. You have to be careful when using absolute reference and relative references. The last thing that you'll want to do is that you want to format row 72 in order to collect the information appropriately after somebody has filled it in above. This is a pretty advanced option, and it's not going to be for everybody. As I am able to get more clearinghouses to give me CSV files that they accept, I will update this on my own so that you can choose and select from different ones. Currently, this is again a work in progress, and Office Ally is the only one that is able to be accepted at this time. Now that we have finished the Clearinghouse tab, we will move on to Authorization tab.